Hi friends, welcome to Diagnox. Today I am going to discuss an interesting case, that's Dentigerous cyst. We all know that Dentigerous cyst is a common developmental odontogenic cyst. It's often associated with maxillary impacted canines and mandibular impacted third molars. Radiologically, there are three types of Dentigerous cyst. One is central, the other one is circumferential, and the third one is lateral. This is a panoramic reconstructed image where you are appreciating an impacted third molar. We are just seeing the crown of the impacted third molar, which suggests that this particular teeth is probably buccolingually positioned. On two-dimensional radiograph, this appearance is called as bullseye appearance. We are also seeing a radiolucency which is seen along the crown of this impacted teeth. We would go into further cone beam CT slices and analyze if it is a true dentigerous cyst. So first we would move on to the NPR slices, and this is an axial image where we are moving up and down. We are in fact seeing the impacted mandibular third molar. This teeth has got a decent crown as well as root. As suggested, this is a buccolingually positioned impacted mandibular third molar. The crown is lingually positioned and the root is fused along the bone. It is seen buccally. We are also seeing a radiolucency which is attached along the crown of the tooth. The radiolucency is extending inferiorly, causing thinning of lingual cortex. We would also move into the coronal slice. This is a coronal slice where you are seeing a radiolucency which is attached along the crown of the impacted mandibular third molar. The hallmark of dentigerous cyst is that the radiolucency attaches along the CJ of the impacted teeth. So, coming on to the normal follicular space, which is usually 2 to 3 mm in dimension, and when the follicular space extends more than 2 mm, like 3 to 4 mm, we call it as hyperplastic follicle. And when this particular follicular space extends more than 5 mm, we can suspect dentigerous cyst, and the measurement of this follicular space is 7.8 mm, which is radiologically diagnostic of dentigerous cyst. We can also in fact see that the inferior alveolar canal is involved along the lesion and it is pushed inferiorly. We would also assess this particular cyst in the sagittal view. You can clearly appreciate the enlarged follicle, which is more than 5 mm, and the lesion is in fact involving the inferior alveolar canal. In fact, the lesion attaches to the cemento enamel junction of teeth. We would move on to the 3D slices to just evaluate the lesion, and from the topmost area, when we are moving inferiorly, you can in fact appreciate the defect involving the mandibular ramus region. So that's it regarding the dentigerous cyst. Stay tuned to Diagnox to see many more interesting radiologic findings of pathologies, many interesting cone beam CT findings, etc. If you like this video, kindly subscribe the YouTube channel Diagnox. Thank you.